USA 9 News at 8 starts now.
Many women have dense breast tissue, which can make spotting cancer really hard on a routine mammogram. So coming up, we're going to talk with a nuclear medicine physician about why supplemental scans and awareness can be life-saving. October is Breast Cancer Awareness Month. And for women with dense breast tissue, a routine mammogram might not be enough to catch cancer early. One woman's cancer went undetected until a combined CAT scan revealed the cancer, and ultimately saved her life. And joining us now to talk more about it is Dr. Esma Akin, a nuclear physician from George Washington Hospital, to explain what all this means. Thank you so much for joining us.
Thank you for having me.
Let's get right into it. Now, for women, we keep hearing about dense breast on their mammogram results. What does this actually mean, and why does it matter?
Well, about 40% of all women in the world have dense breasts. This is especially true around and after menopause. So that's quite a number of women. Breast tissue is made of different types of tissue. One of the tissues is a connective tissue, like a glandular tissue, and the other tissue is a fat tissue, which basically shapes the breast and the size. Glandular to dense breasts have more glandular tissue in them. And if we think about it, cancer needs that glandular tissue to grow. So the more glandular tissue, the more chance of the cancer to grow inside the breast.
You know, we started the segment by talking about a woman who had a combined PET and CAT scan, and that's the only way that they were able to detect this cancer. Let's talk about what that means. Is that directly connected with this, the nuclear medicine or the nuclear scanning?
So nuclear medicine and nuclear medicine diagnostic scanning is not very familiar to everyone. When we hear the word nuclear, we don't know quite what it means. Nuclear medicine basically is an imaging modality. And what it does is we give very small amounts of radioactive material, small amounts that are tagged to molecules that actually have affinity to different parts of the body. We don't just take pictures of the organs, we actually see how they work physiologically with nuclear medicine diagnostics. So it's a very, very useful modality. It's precise, and specifically in nuclear medicine PET scanning, PET CT scanning, which is what saved this woman's life, what we look for is we try to pinpoint tumors with precision, and this precision is very important. Nuclear medicine diagnostic PET CT scans not only prolong life, they improve the quality and quantity of life. It's very, very important to pinpoint exactly where the tumor is. The way we do this very quickly is we basically take a little bit of sugar and we put some radioactivity in that sugar, small amounts, and we inject that to the patient. Why sugar? Well, because tumors are very rapidly growing, dividing cells, basically out of control, right? What do they use for energy? They use sugar. So they will take this radioactive sugar, the tumor, and it will light up, the tumor will light up like a light bulb in our scan. So this precision is very, very important to figure out what the correct treatment is, what the individualized treatment is, be it surgery, be it chemotherapy or radiation therapy, to shrink the tumor and maintain this patient's and our patient's quality and quantity of life. So that's basically nuclear medicine. The radiation we give the patients is not very much. It's basically comparable to a few years of background radiation that we get from everything, from flying, from, even in our kitchen. So it is a small amount of radioactivity to do a very important diagnostic work.
So then it is considered a safe modality, correct?
Absolutely.
Safe, okay.
It is considered a safe modality for what we're trying to do.
Right. Let me get in this last question. Our time is so fleeting, but what is this key message here? If you get a mammogram, should women, especially of a certain age, be asking about, do I have dense breast tissue and what should I do next? Or is this something that the specialist would just tell a patient? Basically, what do we need to do to stay safe and to stay healthy?
Absolutely. Absolutely, we should talk to our providers about dense breast. If you get that little note in your mammogram that says you have dense breasts, please talk to your provider to see what further steps can be done. This could be a 3D mammogram. This could be which is also called tomosynthesis. This could be an ultrasound or an MRI. If you have dense breasts, make sure that you ask for further evaluation of the breast. Dense breasts are difficult even for the very experienced mammographer to see through. So know your breast. The key take home message here is know your breast and ask your doctor what further tests could be done to figure out what's going on.
Dr. Akin, we have to leave it there. Such invaluable information. Thank you for joining us this morning.
Thank you so much for having me.
Absolutely.